Welcome. Hi, my name is Joan O'Brien, and I'm the department chair of the Radiation Therapy Education Department. And with me is Tierney Dygert, who's our clinical education coordinator. And we'd just like to tell you a little bit about what radiation therapy is all about. And this is something that you may not have heard of. And so we want to have you take a look. And what we're going to do is show you some slides, and then we're actually going to have a little bit of a nice video made very recently by one of our graduates, and then we'll wrap up and answer some more of your questions. So what is radiation therapy? What it is officially is the use of targeted doses of powerful radiation that destroy tumor cells, that's cancer, without permanently damaging the patient's surrounding normal tissue. And I bet most of you didn't know that cancer, in the vast majority of cases, more than 2/3 of cancer patients are cured, and radiation therapy is a very big part of that. So what we do is we work with patients and highly sophisticated, very complex and expensive, by the way, equipment. And you're probably wondering, well, what is it that your radiation therapy students are learning to do? On the top, we have our just about to become seniors or juniors and are just graduated, soon to be out in the workforce senior students. So Tierney, what does a radiation therapist do?
Well, Joan, they pretty much do it all from start to finish. Our students start off first in the simulation process. So that's when we get our patients into the position that we want to treat them in every single day. So things that are important when we're thinking about getting our patient in the same position is immobilization. So that's a big fancy word, meaning we want to keep them still and comfortable so that we can deliver very highly targeted doses of radiation only where it's directed to go by the doctor. We use all kinds of different materials in CT simulation to get our patients in the same position. So you may notice here in the background of the photo that we have a CT scanner as well. We use that mainly to get our patient in the same position. It's not for diagnostic images, so we're not diagnosing our patients with those images, but we're using them for treatment planning. We're going to use those scans specifically to make a highly sophisticated treatment plan just for that patient. And we do that for each one of our patients. So as you can imagine, we could be treating a brain patient or a lung patient, and they're going to have completely different setups, completely different plans. So it keeps us on our toes. So once our patients have their CT simulation scan, they go to the treatment planning or dosimetry process. So this is where a medical dosimetrist is going to make a treatment plan specifically for that patient. This is where they can take a look at exactly where the attending physician wants to place the dose and what tissues they really want to avoid. There's a lot of computer time spent here, and our students get to experience this as well. As you can see here, this is what a 3D image would look like inside the patient's body once we use those CT scans, so we can accurately target that tumor or that red tennis ball looking object inside the person's lung. Then the cool thing that we get to do is use multi-million-dollar machines to do treatment delivery. So this is when everything kind of comes together. So we've done our CT scan, we've made the treatment plan. Well, the dosimetrist would have done that. And then that gets sent over to us, the radiation therapist, on the treatment machine. So we're going to use the exact immobilization that we used during the simulation, get our patients set up in the same position, and then deliver those doses of radiation according to the radiation oncologist. We use some pretty fancy machines, and our cancer centers have come a long way to be warm and welcoming for our patients. This is an example of one of our treatment machines at Upstate. The room lights change color, there's music for the patients, and that crazy huge machine suddenly doesn't seem so intimidating when they see our faces every day. This is another example of a treatment machine that looks similar to a CT scan, but it does deliver ionizing radiation. They do pretty much the same thing, just in a little bit of a different way. Again, radiation therapists operate these machines usually in teams of 2, So you really get to know the patients on a personal level. This is another example of a very highly sophisticated machine called Vero. It can actually track the patient's tumor as we're treating it. So when the patient is breathing, the radiation is moving according to where the tumor is located inside the body. It's pretty neat. You know, it might be easier if we just show a video of what it might be like in the day of a therapist and a patient.
Continue, Tierney.
So as you can see in the video, we do spend time directly relating with our patients. So we're bringing them in the room, we get to have conversations with them every day, and we get to work as a team with our fellow therapist. So you really get to know your patients and your team very well. And because we are delivering the high doses of radiation, we have a high level of responsibility within the department. There's nobody else in the radiation oncology department that can press beam on when there's a patient on the table. That means it all comes back to us. We want to make sure we have the right patient, we have the right treatment plan loaded up, and that everything looks good before we press beam on. As I like to tell all the students, you can't take radiation back. So we do work very closely, not only with the therapist, but with the other members of the radiation oncology team. That can include the medical physicist, dosimetrist, and radiation oncologist. We interact with them daily. And because our patients come in for 6 to 8 weeks total, even though we're only seeing them for 15 to 20 minutes a day, we get to see them for weeks at a time, and that helps us develop a close relationship with our patients. We really get to know them, and on their last day, it can be a little sad, not only for them, but for us too. We become part of their lives, and that's one of the best parts about being a radiation therapist.
So traditionally, radiation therapists work weekdays, Monday through Friday. They can be evenings or weekends, but it's really, really rare. They normally work in places like teaching hospitals, community hospitals, freestanding cancer centers, but those are more in urban versus in rural areas. And us radiation therapists have, as here are two of our graduates, a definitely superior academic and clinical abilities. You have to be accurate. You have to be able to get along with lots of different people, old and young. You have to be compassionate. You have to be the kind of person that really can empathize with others. You're able to excel in often a very fast-paced, highly complex technical environment, but while maintaining a pretty flexible outlook on life, because things don't always go from A to B to C. They may go from A to B to Z. And to work in these teams, sometimes larger teams, sometimes extremely small teams. So it's mentally and physically challenging, demanding profession, and it provides a personally and financially rewarding career. It's a great career. Our curriculum is such where you're on campus more in the first semester and a half, and you're out of in clinical most of the rest of the time. And we offer 42 weeks of clinical education that can be completed in nearly all of these regions. We cover the upstate area, and we ask our students when they apply, please select a region to call your home, although you're welcome to ask if you can move around to a different place. After graduation, because we're professionally accredited, our graduates can apply to take the ART on national certification exams and the New York State and other state licenses. And you can go find yourself employment in any radiation oncology center in the United States. And we have had and have graduates in all the regions across the continental US, up in Alaska. We even had a couple that went to Hawaii. And you can go anywhere. The world is your oyster as a healthcare professional. So thank you so much for listening. Tierney and I did enjoy your being with us. And we'll be around to take your questions later on.